The maker's commitment to quality control is very, very firm in our standard operating procedures, but also in the commitment to what we do every single day. Third-party testing is a way to ensure that the product that has been mixed together has been tested by somebody completely outside of the lab that has absolutely no interest in maker's compounding pharmacy whatsoever. That is done on a routine basis. So if we're making something that is, maybe we're talking about a thyroid medication, that's a very, very teeny dose. So we'll send that out, we'll make a triturate, we'll send that out, we'll make sure that it comes back as potent as possible, as potent as we mixed it to begin with. And only at that point will we actually use it in a formula. Why is that important? Well, we want to make sure that we said we did something and that we actually really did it. And we'd really prefer that somebody from outside the pharmacy prove it. It's documented. We have it right there on paper. We also do this with pretty much every preparation that every technician makes, every dosage form. So throughout the year, I will take a sample from each one of the technicians, and they don't necessarily know I'm doing this, and I'll pull some capsules from one batch, I'll pull troche from another batch, cream from another batch, suppositories, etc., and I will intermittently send those off to third-party testing throughout the year. And then again, this shows the technician how well they are doing their job. It reinforces that they are the ultimate professional that they truly are. But third-party testing is really different from the day-to-day quality control that we do here at Makers. So not only are our formulas based in very specific software, and we barcode scan every single element that goes into each formula, we want to make sure that if it says hydroxyzine, that we're not pulling hydralazine. Those words look awful lot alike. So we barcode scan everything to ensure that if the formula is very specific for those 4 ingredients, that just those 4 ingredients go in there. We clean in between each formula. We don't want any cross-contamination. We use very specific airflow as well. But even beyond that, every batch of capsules that we make, if we're making 100, we will weigh the total of what that 100 capsules weighs. We'll compare it to what the formula said it should weigh. And then we'll randomly select 10% and weigh individually what those capsules are. The law allows us to vary plus or minus 10%, but that's not necessarily the best practice, even though that is the standard of practice. We want to make sure that those capsules are as perfect as possible. So quality control is a way to ensure that the preparation that we're making for that individual the first time, the 9th time, and the 19th time is the same. That's the maker's difference. And that is our commitment to ensuring very good formulas are produced here at Makers Compounding Pharmacy every single day.